Welcome to the Delmar Chiropractic Spinal Care class. We have three main objectives with this class. First of all, we'd like to think about health in a way that's maybe a little different than you might think about it traditionally. We want to talk about lots of practical ways you can take care of your spine when you're not in our office, ways that you can help yourself get better faster and stay better. We want to talk just a little bit about how chiropractic fits into those other two. Now, when it comes to health, we like to go by the World Health Organization definition of health, which is that health is a complete state of physical, mental, and social well-being, not merely the absence of disease or symptoms. It's a pretty profound definition if you really think about it, particularly the last sentence. Health is a lot more than the absence of disease or symptoms, right? Because in our society, how do we think about health? We think of it as the lack of symptoms. And really, that is not a great measure of health. For example, often the first sign of a heart attack is a heart attack. That doesn't mean that a person's coronary arteries were healthy for the last 20 years. Things happen over time. And so we want to look at health a little differently. So we think about health as a continuum. One end of health, the high end, is your health goals. Being at your very best, whether it's running a marathon, being able to swing your grandkids between your legs, just being able to walk around the block, doing a triathlon, whatever it is. The other end is the lack of health. And so you are always going back and forth on that continuum. Health is not a static thing. We like to say that health doesn't happen to you, health happens with you. And what I mean by that is what you do plays a big role in your health. So let's say I go home tonight, I stay up too late, I eat some Twinkies and some popcorn before bed, I'm going down that little health continuum. Let's say instead I go home, I exercise, I have a nice salad with some organic chicken afterwards, a little dark chocolate for dessert, go to bed early, well, I'm moving up that continuum. And so what you do plays a big role in your overall health. Of course, genetics matter, environment matters, and there's an awful lot of things that you can control. An interesting fact is that 80% of chronic disease is lifestyle related. That's really an amazing fact, 80%. And so it's incumbent on us to take ownership for our own health and to make sure that we do the things that are necessary. When it comes to health, we think about three major things. We call it the triad of health. On one side, we have the emotional component. Now that from our point of view, that we deal with stress and the effects of stress. There are lots of other professionals to help on that side. There is the chemical component, the second part of the triangle. Now we don't look at that from a pharmacological approach, we look at it from a nutritional approach. And there are tons and tons of things you can do to help your body stay healthy from a nutritional point of view, from different ways of eating to supplements and many other ways to look at that. And your doctor can talk to you about lots of ways you can improve the quality of your life and improve your healing through that. And the final component of that triad of health is the structural component. And that is the part that chiropractic, of course, is most concerned with. And so when we look at the structural or functional or pain syndromes that people will often come to us for, we again do not want to treat the symptoms. A simple analogy is to imagine that you're in a house and a fire starts and the smoke detector starts to go off. Now, what if I, hearing the smoke detector, grab my fire extinguisher, run over and blast that smoke detector until it stops beeping? Well, what has happened? Have I fixed the problem? I have not. I've only put out the symptom. And so a lot of our healthcare in America now has to do with just putting out the symptoms, not necessarily finding the cause and treating the cause. Another joke we often have is that you get headaches because you have a Tylenol shortage. Probably not. It's more likely there's a cause for those headaches, whether it's a nutritional thing, a chiropractic issue, or maybe it's something that's not a chiropractic or nutritional where you need more help with. So again, putting out the symptoms only is not a great way to approach health. Instead, or rather, the Delmar Chiropractic Office and chiropractors as a whole and lots of other holistic providers think about allowing your body or doing the things that are necessary to help your body be its best. Nutrition, exercise, sleep, stress management. There's a whole host of things. And that is part of the reason we do this class. We want to help you get started along those different paths, give you some clues, As always, your health professional, whether it's your chiropractor or other professional, can lead you along these ways. But it is incumbent on us as individuals, and we feel it's our duty as chiropractors as well, to help you find a way where you can produce better results for your health and for your life as a result. The component of the triad of health that chiropractors are most interested in is the structural component. And one way we assess the structural component is through postural evaluation. Posture evaluation is important because it can lead us to areas of symptomatic activity. It also demonstrates to us some challenges that can impact the nervous system. And that's really where chiropractic gets its power. And its healing power is from the impact of the adjustments on the spine and therefore the nervous system and your overall health. So when we look at posture, perfect posture from the side is ear over shoulder over hip over knee over ankle. So we're balanced nicely front to back. From the front, it's the middle of our head, the middle of our chest, middle of our hips, toes going nice and straight forward, out 10 degrees or so. This allows our spine to exist in its most efficient manner. Now, when our posture is off, we have a high shoulder, our hips are tucked under, we're leaning to one side, our body is not dancing with gravity efficiently. Often that results in pain. It also results in poor information to our central nervous system. The old-time chiropractors used to think when you were out of alignment that the bones would pinch the nerve and that would cause disease. Now, a very interesting way of thinking about it. Turns out that's not quite how it happens. What we know now is when somebody's spine is not working efficiently, it's more the change in the input to the nervous system that causes not just the pain, but some of the other non-somatic or non-structural symptoms that people get and seem to resolve from chiropractic care. So with the posture, you want to have the good ear, shoulder, hip alignment, allows your spine to work most efficiently. And then an interesting finding from the American Journal of Pain Management, what they state is that abnormal posture affects essentially every physiologic function. We know it causes pain, but it also influences things as diverse as hormone production and nervous system control. So having good posture is more than just looking good or just keeping yourself out of pain. It helps your overall body be healthy.
How you doing? I'm Dr. Mike. I'm going to be talking to you about some basic functions that you do throughout your day that have a large impact on your spinal health. One of them is the sit-to-stand mechanism. I'm going to use Dr. Tim here to help demonstrate. Dr. Tim, if you want to come in here. So when you're doing a sit-to-stand mechanism, the most important thing is that you keep your spine in alignment. When people have back pain, their kind of go-to thing is to really throw themselves out of alignment, and that's the worst thing that you can do. So what we're going to do here is we're going to practice the sit-to-stand mechanism. As you can see, Dr. Tim has a really nice straight back here. You want to maintain this throughout the entire motion. The first thing he's going to want to do is to maybe scoot forward a little bit in his chair and still maintain that straight back. He wants to look up towards the ceiling. The main thing that you want to pay attention to here is your low back. You don't want your low back to bend forward. If you could just demonstrate that for me, Dr. Tim. There you go. That's bad. So that's what you see everybody do. We're keeping this low back really straight, and then he's going to look up towards the ceiling and he's going to come straight up. Perfect. So if you were to look at him from a profile, you would see that his ear is over his shoulder and his shoulder is over his hip. So now when you're going back down into the chair, the first thing that you want to think about is putting your butt all the way back into the corner of the chair. So you're not sitting at the end. If you want, you can sit at the end and then scooch back. A lot of people prefer to go all the way back, so that's what we're going to do right now. Dr. Tim, if you want to go ahead and just aim your butt right for the back of the chair, keeping your back nice and straight. Excellent. Very good. That's a perfect sit-to-stand mechanism. If you can do that properly, it will really save your back a lot. So the next thing we're going to be talking about is the Brugger Maneuver. The Brugger Maneuver is an important tool if you sit at a desk all day long. Basically what it does is it realigns your spine and removes a lot of the stress. The first thing that you want to pay attention to if you're doing the Brugger Maneuver is that you're not slouching. Okay, so again, this is going to help protect your back from the stress, so we want to keep you in alignment. If there's a elbow rest like this on your chair, you're just going to want to scoot forward a little bit. So the next thing you're going to do for this Brugger Maneuver is you're going to roll your shoulders a little bit. Think about putting your shoulder blades in your back pocket. Put your palms up like this, and then make sure your head is in a nice neutral position so you're not looking down. Okay. This is a really good position. Once you're in this position, you just let your arms rest to your side. So go ahead and do that for me, Dr. Tim. Just let your arms rest down to your side. If we're resetting your position when you're sitting at a desk, this is almost right where you want to be. If you actually want to scoot back, we'll demonstrate, how you're sitting at your desk. So right now, Dr. Tim, let's imagine he has his desk in front of him. He has a decent knee angle. Actually, when you're sitting at your desk at work, you want to make sure there's a slight decline from your hip to your knee. All right, and that'll make sure there's not a lot of stress on your back. One of the other things that he's doing really good is he's arching his lower back, so he's not rounding forward. He has a nice back support here that's pushing his low back forward, and it's keeping his back in alignment. All right, another thing that you'll notice is his shoulders. So his shoulders are right below his ears. They're not kind of curled forward like this. All right, his head and his neck are in a really good position. As far as his computer screen is concerned, if you have a computer screen at your office, basically you want the center of the screen to be 8 inches below your eyesight and 18 inches away from your face. Okay, so it has to be relatively close there. The next thing that you want to pay attention to is that your keyboard isn't too far away and that your mouse isn't too far away. As you can see there, if it is too far away, you're going to be reaching too much and it's going to pull you out of that alignment. So the next thing we're going to be talking about is lifting mechanics. Again, lifting mechanics are really important to spare your back. It takes a lot of stress off your low back in particular. If you can do this maneuver right, it will help you out quite a bit. So the first thing to do when you're lifting, again, is you want to make sure you're keeping a good alignment here. As you can notice, Tim's ear is over his shoulder and over his hips, and he wants to maintain that the entire time when he's going to lift this basket. The movement starts with a hip hinge, so very similar to a deadlift if you're a weightlifter. As you can see here, his ear is still over his shoulder and over his hips. He's still in perfect alignment, and he's just going to bend his knees a little bit, keeping everything straight. He keeps his chin up, he's looking towards the ceiling, and then he comes straight up with it. And the movement is exactly the same if you were to place the item back on the ground. So go ahead and demonstrate that. Perfect, excellent. And that is lifting. So the next thing to talk about is driving ergonomics. Driving ergonomics is another area where people really struggle. The main things that you want to pay attention to when you're driving is that you're close enough to the steering wheel that you're not reaching for it, and also close enough to the pedals. So that's really where people get themselves in trouble. So when you start to reach for the pedal, as you can see, Dr. Tim is curving his back. And that's exactly what we want to try and avoid. Again, we want to try and keep that nice, normal, neutral posture. One of the things that you want to do, a nice little trick, is to set the rear view mirror as soon as you get in the car with the good posture, because then if you start to slouch, you won't be able to see out of your rear view mirror as good as as when you got in. Sleeping ergonomics is the next thing that we're going to talk about. There's a few things that you want to pay attention to. when you're trying to get yourself in a good position for sleeping. The main one is that, again, you want to be in a neutral position, and that's really what we're trying to accomplish when we talk about good sleeping ergonomics. So again, your head is going to be over shoulder, is going to be over your hips. The easiest way to get yourself into that position is by laying on your back. Okay, so you want to use a pillow that's not going to push your head too far forward, or you want to use enough pillow so your head's not falling backwards like this. Then you're in a nice anatomical position if you're sleeping on your back. If you're sleeping on your side, the main thing that you want to pay attention to is that your head isn't falling down like this. You can also put a pillow in between your knees in order to prevent your pelvis from turning. But again, as far as that pillow underneath your head is concerned, you want to make sure it's big enough that it's going to take up this space between your shoulder and your ear. One of the ways that people sleep that is not good and that we don't recommend entirely is sleeping on your stomach. And that is pretty much the basics of sleeping mechanics.
So how does chiropractic address the structural component of the triad of health? Well, we do it in a number of ways and in different fashions. Number one, there's analysis. We use postural analysis, functional analysis, palpation, orthopedic and neurologic testing. Always the goal is to figure out not only where's the pain coming from, but what the underlying functional/structural problem is. Now, we will address that using many different techniques. Traditionally, chiropractors have used their hands. In fact, chiropractic means to practice by hand in Latin, which is always interesting. We also have tables that we use that are special and gentle. We use instruments at times. Each person gets an adjustment that is perfect for them, their situation, and their body. We know that if we can correct the structural and functional issues that someone is having with their spine, that will impact their nervous system, and as the nervous system is the controlling system of our body, by improving spinal function, we can improve nervous system function, and so not only will you feel better, but you will be healthier overall.